Many people in Brisbane, mostly women, suffer from low levels of iron in their systems. One option is to turn to your local integrative medical centre for iron infusion. What is iron infusion? Iron infusion is a medical procedure where iron is delivered into your body intravenously. It is more commonly known as intravenous or IV infusion. Iron infusions are usually prescribed to address iron deficiency anemia or IDA. Iron is one of the vital minerals in the human body and functions as one of the components of haemoglobin, a carrier of oxygen in the red blood cells. The presence of IDA can be treated with dietary changes and with the intake of iron supplements. However, there might be cases where infusions would be needed. Who are prone to IDA? Women, they experience blood loss due to monthly periods, pregnancy and breastfeeding. Individuals who are aged 65 and above. Those with a poor diet. Vegetarians and vegans. Individuals who are having trouble with absorbing iron. Individuals who take medications which interfere with iron absorption. Those who have celiac disease. What happens during iron infusion? Iron infusion takes place at the hospital or at a hemodialysis centre. A doctor or a healthcare provider will insert a tube into the vein and then an IV bag of iron is connected to the tube. This solution is either pumped into your vein or it is allowed to slowly drip down the tube with the help of gravity. After the first dose, the patient is checked to see if there are any adverse reactions. Iron infusion usually takes 3 to 4 hours to be completed, although there might be some exceptions depending on individual patient needs. For example, some patients need a slower infusion rate to prevent complications. How to maintain good levels of iron. Diet is important in maintaining iron levels. However, diet alone does not address lifting iron levels to normal. Your doctor might recommend supplementing your diet with iron supplements, which need to be taken for a few months. This only works if the case of IDA is only mild. Cases that need intravenous infusion are patients who have very low levels of iron in the body. What should a Brisbane patient expect after iron infusion? Once iron infusion has been administered to a patient, iron levels are expected to peak after 7 to 9 days. This is a great way to restore iron levels into normal levels rapidly. Most patients are able to return to normal activities right away and even drive themselves home after the infusion. However, there are some that might experience physical discomfort after the infusion, but these cases are mild and temporary. Any allergic reaction or toxicity brought about by an iron infusion should be brought to the attention of a hospital emergency room immediately. Need further advice about iron infusions? Book an appointment with one of the specialists at Ubuntu Medical Centre, Stafford. Call us today on 07 3857 3777.